When ADHD meets trauma, what we're missing? What are we not looking at? A child who can't sit still, who interrupts, who seems defiant. But what if that same child is just struggling with attention? What if they are also trying to survive? The problem is that the children with attention deficit hyperactivity disorder are not just managing neurodevelopmental differences in executive functioning, impulse control, and emotional regulation. They're actually vulnerable to adverse childhood experiences, including physical, verbal, emotional, sexual abuse, as well as neglect. The clinical research shows that children with ADHD are more likely to be misunderstood, harshly disciplined, and exposed to chronic stress environment. Their behaviors, hyperactivity, impulsivity, emotional reactivity, can inadvertently increase the caregiver's frustration, sometimes escalating into a maladaptive or abusive responses. And this creates a dangerous intersection between the neurodevelopmental vulnerability meets the environmental trauma. So here are some of the patterns. For a neurobiological perspective, ADHD already involves the dysregulation in dopaminergic and noradrenergic systems, particularly in the prefrontal cortex, areas responsible for attention, inhibition, and emotional control. Now add trauma to that. Exposure to abuse or neglect activates the child's stress response system, which is the hypothalamic pituitary adrenal axis, leading to chronic elevations in cortisol, and over time this results in toxic stress, altering the brain development, particularly in the amygdala, fear processing, hippocampus memory, and prefrontal cortex regulation. For a child with ADHD, this can amplify symptoms into what we often see as heightened emotional dysregulation, intense anger, meltdowns, hypervigilance, mistaken for distractibility. However, impulsivity as a trauma-driven survival response, disassociation or shutting down in cases of severe abuse, attachment disruptions which are leading to mistrust or clinginess. So here's what research has indicated and what research has shown us, that strong overlap between ADHD and trauma-related conditions like complex post-traumatic stress disorder. In fact, trauma can both mimic ADHD symptoms and exacerbate existing ADHD, making accurate diagnosis and treatment a lot more complex. Children that are exposed to verbal and emotional abuse may internalize the chronic shame, leading to negative self-concept and rejection sensitivity. Dysphoria. Physical abuse may heighten the aggression or fear-based compliance. And sexual abuse often results in profound disassociation, boundary confusion, and long-term relational difficulties. Neglect perhaps is the most invisible that disrupts attachment formation and emotional development at its core. These are not bad behaviors. These are adaptive survival responses. What we should actually look at is we need to shift the question from what's wrong with this child to what has this child experienced and what do they need to feel safe and secure. For parents, for child caregivers and educators and clinicians, we should adopt a very systematic pattern. We should look at trauma-informed, neurodevelopmentally sensitive approaches, prioritizing emotional safety over behavioral control, recognize that punishment can re-traumatize, not regulate. Integrate evidence-based interventions like trauma-focused, cognitive behavior therapy, parent training, and regulation-focused therapies. Screen for trauma whenever you are assessing an ADHD person and vice versa, because when we understand the intersection of ADHD and trauma, we stop labeling children and start protecting, regulating, and healing them. I hope you liked my video. And if you are interested in more topics like this, I will be more than glad to do more videos on this topic. Leave a comment or two, subscribe to my channel, and if you like the video, please hit the like button and promote my channel to grow. Thank you so much.